Sorry. Namaskar. This is Dr. Kumar Rishikesh, medical oncologist at the Indraprastha Apollo Hospital. Month of October is observed as Breast Cancer Awareness Month. And in the current scenario, when the number of cases we come across in our clinic are increasing, it is very important to understand how it is treated, and especially for the patient, caregivers, and the family. It becomes very important to understand a little bit about it. So, why it is important, or whether it is important to remove the whole of the breast when a person, a lady is diagnosed with the breast cancer? This is a very important question and important dilemma. If you go back to 50s and 60s, then the breast cancer surgery was very extensive surgery. The whole of the involved breast was removed. Along with that, the axilla, some part of the lymph nodes were across the neck, all were removed. It was very debilitating surgery and mostly resulting in the incapacitating of the involved limb. So suppose the breast cancer was at the left side, then after surgery, there was some or other issues with the left upper arm because the surgery was so extensive. It resulted in a lot of morbidities for the patient. Gradually, this changed into simple and then radical mastectomy, followed by nowadays that is called modified radical mastectomy. So in modified radical mastectomy, the breast is removed and in the axilla, the lymph nodes are resected. Usually the muscle behind the breast is not involved. If it is involved, then you have to undergo radical mastectomy. So depending on the involvement, the surgery is chosen. That is very important, and that is the result of clinical trials in modern days. Further to that, there is a breast conservation surgery where the breast is left intact, tumor is removed like the lumpectomy, and along with that, depending on the lymph node involvement on the same side of the axilla, lymph node is dissected. However, then further improvement there, and when you do sentinel lymph node biopsy, I will elaborate a little further on these. So first come to why it is important to remove the breast, wherever it is removed, in whichever cases. So it is important to understand that when the tumor develops in the breast, it may be one focus, or it may be the multiple focus. So more than one area of the breast is involved by the tumor. So separate tumor coming out in different areas. So in those cases, if you have to remove the breast, if you have to preserve the breast, it becomes difficult because ultimately after the resection, not much would be left for a meaningful breast. So the mastectomy is done where the whole breast is removed. Similarly, if you go ahead and little small size of the tumor, single focus, then you don't remove the whole breast. You remove the tumor. Along with that, part of the normal breast is also removed, a very thin layer, very thin rim, you can say. And after that, the second portion is whether to remove the lymph node. That I will come later. So the two types of surgery in which one breast is removed, in other, the part of the breast is removed and most of the breast is left intact. The decision to do one or other surgery depends on number of tumors present in the breast, removing the part of the breast, and what would be left. That is also important. Third, whether patient would be able to undergo radiation treatment or not. So if a patient is having contraindication to radiation, like some skin diseases, some connective tissue diseases like scleroderma, then radiation is contraindicated. You cannot give radiation. Then it is important to do the whole business by the surgery, and you don't leave anything for the radiation to take care of. Of course, chemotherapy is a separate issue. I'm not discussing that here. So the two types of surgery in which one, the whole breast is removed, and other, in the part of the breast is removed. You would be surprised to know that it does not matter whether the whole breast is removed or the part of the breast is removed. If you complete the treatment, whatever indicated, like surgery plus radiation, were indicated, and were not indicated only surgery, and plus minus chemotherapy were indicated, the results remain same. So it does not matter if it can be done, then conserving the breast is also important and part of the modern day breast cancer surgery. So do not get scared of that my whole breast would be removed. It all depends on the tumor size, your breast size, type of breast cancer, your genetic history. Now, the fourth thing which I just mentioned is the genetic history or genetic findings. If a lady is having mutations, genetic mutations, where we understand that you have another chance of or future chance of developing breast cancer, same breast or opposite breast, then we strongly recommend removing the whole of the breast, like in cases of BRCA1 or 2 mutation. You might have heard about the celebrities removing the whole of the both breast and the ovaries and going public about it. So it is important, where indicated, to reduce the chance of recurrence or almost completely negate the chance of recurrence, whole of the breast is removed. However, it is important to understand for the current cancer which you are being treated, it is not always necessary to remove the whole breast. But there are indications where the whole breast removal is important. The first, when you have genetic mutations of BRCA1 and 2. Second, if it is inflammatory breast cancer, where the skin is involved by the cancer. Third, where there is contraindication for using radiation. And fourth, if you understand or the doctor understands that after removing the cancer, meaningful breast with the cosmetic purpose won't be left. So it's better to remove the breast. And also I would like to mention that in all these cases where indicated, where possible, breast reconstruction can be done. So my first information for you was it is not always necessary to remove the whole breast, because most of the time disease outcome remains same. Now coming to my second important discussion, why the whole axilla is dissected sometimes and sometimes not. Axilla is important site for lymph node metastasis in the breast cancer. So lymph node is the area, lymph node are the nodes which are present around breast. So it may be in axilla, it may be above the clavicle, below the clavicle, between the bones of the chest. So these are the different area where the lymph nodes could be involved before the disease spreads further to your important organs like liver, lung, brain, or even bones. So when we are trying to find the lymph nodes, we try to find on the scanning whether the axilla is involved by the lymph nodes, or the axillary lymph nodes are involved, whether the clavicular lymph nodes are involved, where the memory lymph nodes, inframammary lymph nodes are involved. All those cases are to be searched by the scanning, by the clinical examination, and sometimes when necessary, the needle test. So it is very important to remove the lymph node if it is involved. But all these cases happen when disease is not advanced, like it is not a stage 4. Because if it is stage 4 disease, then mostly the chance of surgery or the purpose of surgery is not there. So usually you don't go for surgery in stage 4 breast cancer. The breast cancer is treated with the help of surgery initially before the stage 4. Now, why lymph node is to be removed? This is a very important thing. First, it gives you the information about the staging, because sometimes the clinical judgment like PET scan may not be right. If PET scan is showing some positivity in the lymph node, actually lymph node may come out negative or inflamed because of different reasons. So actual staging is done with the help of surgery only. So where the lymph tumor is small or limited to the breast, one quadrant or sometimes more than one quadrant, then you also check lymph node whether it is involved or not. So the first site is axilla. You go for the dissection and you see whether the lymph nodes are involved or not. Now, further improvement in that is sentinel lymph node biopsy. So what we do, we examine the patient in clinic and we find that there is no lymph node involved in the axilla on clinical examination. Then we also confirm it with the ultrasound or the further going up like PET scan. And if it is not involved, then still we do not leave the axilla like that. What we do, we inject a blue dye and radioactive material, either of these two or sometimes both, into the breast tissue, tumor tissue, and the lymph node which would be draining that tumor tissue, usually present in the axilla, will change its color, or we can detect the radiation with the special machine. So what we do, actually, we put some medicine or chemical into the tumor tissue and see where it is going. If it is going to the lymph node, the first lymph node which is present, we take it out, we see whether it is positive or not. Similarly, we take sometimes 3 lymph nodes. And if all 3 are negative, we do not dissect further. So all our axilla is intact thereafter. Why it is important? Because it has been seen, it is a very common thing. If you dissect the lymph nodes out of axilla, then you find the comorbidity in the form of swelling of the arm, involved arm, and that remains very long. That remains there for a long time, and that is very difficult for the patient to manage. It other than the cosmetic issue, it also worsen your dexterity, your movement, your work things. So it is important to save the lymphedema from developing, and the important contribution by the sentinel lymph node biopsy has contributed, immensely in preserving the character or the architecture of your limb, especially the upper arm, the arm of the involved side of the breast. Okay, so this is the second thing which I discussed. The third thing I'm trying to make it clear that in stage 4 metastatic breast cancer, stage 4 or metastatic breast cancer, it is not necessary to remove the breast or do even partial surgery, except there are certain indications when the metastasis or the stage 4 disease which we are describing is having a very limited number of metastases, 1 or 2, in fact less than 3 or 3. Some consider it up to 5 also. So depending on the metastatic deposits which are present in the body, we try to treat these patients with curative intent. So we understand that the disease has gone a little far, but we still try to cure the patient with this treatment remaining a standard line of treatment for those where this is stage 3 or 2 or 1. So this is a little different, and this is not practiced in all cases. So not all stage 4 cases would be treated in the line of curative treatment. There will be selected few whose disease is very less aggressive, limited number of metastases. In those cases, we treat the patient with curative intent, and in those cases, we remove the breast. We try to figure out where these are metastasized, and those metastatic deposits also either removed surgically or given radiation. And this way, your body becomes free of any cancer at that point of time, and you also receive a chemo or immunotherapy where applicable. So except in those cases where you are treating with the curative intent, in the stage 4 cancer, you do not remove the breast. Other indication could be the toilet mastectomy is to be done, like if there is a big wound in the breast and the discharges and the smell and that kind of things. Usually it does not happen, and it does not occur in all cases. But where we find, we try to do the toilet mastectomy so that quality of life is good for the patient and a caregiver. So this was the third indication where you do the breast cancer, where you do the mastectomy. So now these 3 things cleared, I would also try to bring out important discussion. What happens if you have germline mutation? That means your every single cell of the body is having mutation in the form of BRCA1 or BRCA2, which increases the chance of developing breast cancer manifold. So in those cases, it is indicated to do prophylactic mastectomy. That means you don't have cancer as of now. However, to reduce the chance of developing cancer by 95 to 98%, you do the mastectomy on bilateral. In those cases, usually lymph nodes are not removed. Only the mastectomy, simple mastectomy is done with the breast is removed. And thereafter, after a certain period of time, breast is reconstructed as per the patient wish. Plastic surgeons have important role in the breast cancer reconstruction. So, but the important thing about this prophylactic mastectomy is patient and doctor had a long and informative discussion why it is necessary, whether patient wants to do it or not, and further things. So this was the fourth thing where the mastectomy is done. So in those cases where you have prophylactic mastectomy, you don't keep any part of the breast intact. Um, the fifth thing I would like to discuss about those even going for a bigger surgery like mastectomy and part of removal of the breast, that breast conservation surgery. Sometimes it is important to, or the patient wish to preserve the nipple and areola, and if it can be preserved, that is having a good cosmetic outcome for the for the patient. However, it is not always possible, and there is also a drawback that usually when you do the nipple preserving breast surgery, then the nerves are not preserved, and though cosmetically it may be okay, but nerve sensation does not remain intact with the nipple. Um, so it is a matter of choice what the patient wants, and accordingly the doctor also decides. So ultimately, what I would like to say, this is not always necessary to sacrifice the breast, even if you have been diagnosed with the breast cancer. However, there are certain indications, there are certain conditions where it is necessary to do prolong your life and reduce the chance of recurrence. I hope on the in the month of this breast cancer awareness, I have reached to you and tried to explain why breast cancer surgery and when it is done. Thank you very much. If you have any questions, please let me know. Thank you. I have Ms. Trishika Iyer. What is inflammatory breast cancer? A very good question. Inflammatory breast cancer is a very, you can say, the aggressive form of breast cancer. Though, why we say it's inflammatory breast cancer? Because it spreads very fast through the skin, especially, and a very aggressive disease. And you have to tackle it very fast. Usually, the treatment starts with the chemotherapy first, so that the inflammation also reduces, because uh, breast cancer cells are spreading through the dermis. You know, the epidermis and the dermis, through the dermis. And when you treat it with the chemotherapy, the cancer cells are killed and the inflammation stops. However, it is not always the case, because sometimes you have aggressive disease and you have to look for other options as well. So the inflammatory breast cancer is a type of breast cancer which is very aggressive, which involves the skin also and the dermis. Part of the, structurally, the dermis is the part of the skin. And usually you start with the chemotherapy followed by surgery. Breast conservation is usually not done in inflammatory breast cancer. Next question. When should I begin screening for breast cancer? Thanvi, very good question. The current recommendation for a general population is 40 years of age. And usually because of the 40 years of age, women have the dense breast, so mammogram may not be effective. So gradually we have seen the shifting of this protocol to 43 to 44. However, those patients, those persons who are having the family history of breast cancer, strong family history of breast cancer, that means first or second degree relative developing breast cancer, young age breast cancer in the family, then we start early, or sometimes at the age of 25, we start screening. In those cases, we have to do the breast MRI for the screening purposes. So X-ray, mammogram, ultrasound, and as needed, breast MRI, bilateral breast and axilla MRI are important method to screen the breast cancer. And the timeline, as I told you, varies from varies with their family history, personal history. Suppose a lady has already developed a breast cancer early, then we call it surveillance, and we keep checking with the regular mammogram, and if needed, further imaging to detect the early breast cancer. second cancer in the same person in different breasts. Thank you. So this is from Elango. What are the possible side effects of each treatment option? Okay. If you are asking about the surgery and side effects, then of course, for the surgical point of view, breast cancer conservation surgery is better because you undergo surgery definitely, and with the surgery there are always implied things like there will be cut marks, and breast size may differ from one to other. If it is the mastectomy, then of course the whole breast would be removed. So this is, of course, you can say the possible outcome which patient is usually ready. However, the lymphedema, the development of the swelling in the whole of the involved arm is also a side effect of breast cancer surgery when the axilla is dissected completely. So it is known that 12 to 15% patient undergoing radical mastectomy may develop a lymphedema of the involved arm. And this is important for cosmetic, not only the cosmetic purpose, but also for the dexterity of the arm, and also a long-term chance of development of sarcoma in the involved arm, though it is very rare, but it happens. So these are the things which are important things to consider before you undergo surgery. However, if you are at right place with the discussing with the right doctor, you would get the best available care, which are supported by the clinical trials till this point of time. Next question. Mrs. Naidu, how quickly do I need to make a decision about breast cancer treatment? It's very important thing to understand. Though we do not say any timeline, however, the cancers are different. Cancer have a different aggressive pattern. So a triple negative breast cancer could spread very fast. In 1 month time, we have seen patients developing lymph node metastasis. So which was till the time was only in the breast, and after 1.5 month examination, we found that the axilla became positive. So it is very important and advisable that do not delay the treatment without any meaningful reason, and reach to your doctor as soon as possible. After investigation, doctor will advise you and schedule your treatment. Yeah, next question. If there is any more question, thank you. Thank you for your time. So I hereby close this discussion on the live session on Facebook. Thank you for your time and support.